morning to all of our media partners. I'm Dr. Amy Person, Health Officer, the Benton-Franklin Health District. Welcome to May 20th, 2021 media briefing. Over the last couple of weeks, we've seen some important progress and significant changes for our local case rates. Both Benton and Franklin counties are seeing disease activity trends going down, which is excellent news. The one age group where we continue to see more cases and higher case rates is in our 15 to 19-year-old age range, and their disease rates are still rising in contrast to the rest of the demographics. Hospitalizations are also improving, although that improvement is lagging behind our case data, which is to be expected. With the increase overall in cases in younger ages, we do see that reflected in our hospitalizations as well. In the first quarter of the year, half of the people who are hospitalized were over the age of 64, and in the month of April, that had dropped down to age 54. So half of the people who were hospitalized were under 54. We continue to see excellent response to the vaccine in our 60+ age range. So their case rates have remained flat since March, and their hospitalizations continue to remain low. From the most recent modeling report from the Department of Health indicates that for the 60 and older age range, those who have been vaccinated are 10 times less likely to be hospitalized if they do develop COVID-19. So again, the power of vaccination in preventing morbidity and mortality from COVID-19 is demonstrated. With the governor's news announcement, the focus now is really on increasing vaccination rates. So we are looking to improve vaccination rates so that we can continue to open businesses more and allow more interactions among people, both socially and economically. It will be important, though, locally for us to continue to follow those disease activity and hospitalization rates. As we see more people out gathering together, we will need to ensure that we don't see a return of increase in disease activity or hospitalizations. Will still be important to get tested if people have symptoms or have been a close contact of someone with COVID-19. There are additional options for testing with the availability of over-the-counter tests. Those over-the-counter tests can be a great screening mechanism for people who want to know immediately if they have symptoms, if they do have COVID. Will be important for people to recognize that those over-the-counter tests are not going to be accepted as proof of COVID or no COVID if you're going to be traveling or if you want to get out of quarantine early. The over-the-counter tests also are not included among our disease activity or case rates. On the vaccination front, Benton County has seen approximately 73,400 people initiating vaccine. That's 46% of our population age 16 and older. We have about 39% of people aged 16 and older in Benton County who are fully vaccinated. Franklin County, 26,500 individuals have initiated vaccine. That's approximately 38% of the 16 and older population. And we see about 31% that have been fully vaccinated. So we are seeing those numbers continuing to increase, although we still have a ways to go. The goal to be able to open the state earlier than the June 30th date is for 70% of Washingtonians to initiate vaccination. We are about half of that, so we have some work to do in Benton and Franklin counties. In Washington state as a whole, about 59% of the population, 16 and older, has initiated vaccination. Vaccination continues to be widely available in our community. We still have the mass vaccination site, as well as many providers and pharmacies offering vaccination. Our CBC West site is open for vaccinations on Sundays between 9 and 3:30 p.m. To offer an option to people who can't use or are unable to get to any of those other sites. Health District has also been working with our other community healthcare partners to do pop-up clinics, both at work sites and around the community, so that we can reduce barriers to vaccination in communities where there may be more vaccine hesitancy. Those clinics may not be as large volume, but the Health District is committed to continuing those so that we can build trust in those communities that vaccines are a safe and effective way to develop immunity against COVID-19. Last week, CDC released new guidance around masking as evidence for the success for vaccination, not just in preventing hospitalizations and death, but in preventing infection and transmission of COVID-19 in those who have been vaccinated. They now recommend that people who have been fully vaccinated do not need to wear masks indoors unless required by other federal, state, or local requirements. As a reminder, this is for people who have been fully vaccinated. So those who have received 2 doses of the Moderna or Pfizer vaccine or a single dose of the Johnson & Johnson. 2 weeks after that final dose, you are considered fully vaccinated. Individuals who are not vaccinated should continue to wear their masks, particularly indoors, so that they can reduce their risk of getting COVID-19 or of spreading COVID-19 to others. On May 15th, Secretary of Health Shah updated the state masking guidelines, which align with CDC's recommendations. So adding to the exemptions for wearing masks indoors, persons who are fully vaccinated do not need to wear masks indoors unless they are in healthcare facilities, homeless shelters, correctional facilities, schools, or on a mode of transportation such as bus or plane. We are still awaiting guidance from labor and industries as to how businesses can put this new recommendation into effect. Local businesses always do have the option to ask their patrons to mask if they want to, for the safety of either their customers or their own staff. I will be updating our local masking mandate as well to conform to the state guidelines. Benton and Franklin counties continue to be in phase 3 on the road to recovery, as do all of the counties in Washington state. It's anticipated that everyone will remain in phase 3 until June 30th, when the entire state will move forward together. Governor Inslee has also put out an option for the entire state to move forward sooner if 70% of those eligible for vaccination initiate vaccination. This is a positive sign that we are able to do something proactively to provide sustainable and lasting protection against COVID-19. So we hope that we will continue to see people taking advantage of the opportunities to get vaccinated in Benton and Franklin counties. We are particularly encouraged to see the number of families that are choosing to get their 12 to 17-year-olds vaccinated. In the week that vaccination has been available for 12 and older at the mass vaccination site, approximately 30% of people getting vaccinated have been those age 12 to 17. That likely speaks to the trust that families have in other childhood vaccinations and in understanding the power of vaccination to prevent disease and to allow children to remain in school without disruption due to being either infected with COVID-19 or being exposed to someone and needing to quarantine. And at this time, I will now turn it over for questions.
Thank you, Dr. Parson. With communities of color disproportionately affected at higher rates for risk of COVID-19, could you explain how the health district is trying to reach more of these communities and be more equitable in vaccine?
Well, that's a great question. And equity is a focus at the health district. It is part of our mission pre-COVID, and with the knowledge that COVID-19 has disproportionately affected our communities of color, we have been working again with community partners and healthcare partners to provide vaccinations within those communities and also to do additional outreach, both through media, at work sites and in the community with trusted partners and in appropriate languages so that we can address concerns in those communities and again, can provide services without barriers.
Thank you. Our second question is, what is the plan for the Benton County mass vaccination site, and is there a demobilization planned?
Yes, the mass vaccination site will be demobilizing at the end of the month. We have been told to prepare for that. The health district has been planning for that through a couple of avenues. One, we've been working with the CBC West site so that they'll be able to increase availability of vaccinations after demobilization. We are recruiting additional providers in the community so that vaccinations will continue to be available. However, we would also encourage anyone who is thinking about getting vaccinated to take advantage of the mass vaccination site while it is still available, as it does provide the highest volume and highest throughput of vaccinations in our area. We have been fortunate to have that resource available in our community, but also recognize that the support for mass vaccinations, utilizes staff and resources that will need to be pulled to other priority areas, particularly with wildfire season coming.
A clarification is asked for the specific date for the demobilization.
And I believe it is May 29th. I'm going to look to someone. Yes, I'm getting confirmation. So yes, we've been told that May 29th is the anticipated date for demobilization of the mass vaccination site at the Benton County Fairgrounds.
Are you able to clarify if the demobilization is occurring because of the decline in people getting vaccinated at the site?
The demobilization is occurring, as my understanding, for a couple reasons. One, the purpose of the mass vaccination site initially was to be able to quickly provide a large volume of vaccinations when they were first available. That was to allow communities to develop additional resources through pharmacies, provider clinics, and the local health departments, such as the Benton-Franklin Health District, to be able to continue that service. It utilizes the incident management team support, which will also be needed to support wildfire management. So I would say it's really a matter of demobilizing the mass vaccination sites as we have the local infrastructure to be able to provide vaccinations on a continuing basis, and then to allow for that support of other disasters and emergencies in the state.
With the new CDC mask guidelines, what guidelines does the health district encourage, and do you feel that it will give leeway to non-vaccinated people to remove their masks?
With the CDC's update in their masking guidance was really recognizing that the emerging science, research, and data on COVID-19 vaccinations indicates that they do provide lasting protection, not just against hospitalization and death, but also against COVID-19 infection and transmission. With that recognition that people who are fully vaccinated have that protection, it does allow the option for them to no longer need to wear masks indoors or outdoors unless required. We do know there is an element of trust that most people do want to do the right thing. We do recognize in this community, as in any other community, that there may be people who are unvaccinated who will take advantage of this to not wear their masks. But we are reassured by the knowledge that with the availability of COVID-19 vaccination providing a safe and effective way for those who choose to be vaccinated to be protected, that even if we do have those individuals who may be putting themselves or others at risk, there are options that people have. So we are confident that with this update in the masking guidance, that we do not expect to see a significant spike in our disease activity.
Dr. Person, we are getting clarification that the last day of operations is the 28th of May. Are you able to repeat that statement?
Yes, I'm sorry. So the last day of operations for the Benton County mass vaccination site will be May 28th. So that one is to clarify a misstatement I made earlier.
There are no additional questions if you have any closing statements.
Yes. So I think we are beginning to reach a turning point in where we are with the COVID-19 pandemic. So our conversation is not just about how can we keep disease rates down, which is really more of a reactive stance, but we are really now able to take a more proactive stance by looking at how can we continue to increase the numbers of people who choose to be vaccinated so that we can continue to move forward, both in providing for additional economic and social opportunities for our residents. My ask for the community is that we would continue to respect one another and to be kind to one another, as we will continue to see people who are either choosing to be vaccinated or choosing not to be vaccinated, choosing to continue to wear their masks, even if they're vaccinated, or even some people who may choose to not wear their masks either because they're vaccinated or not. I'd ask that we all remember to be kind and not to assume that someone's doing the wrong thing. With COVID-19, over the last several months, it has been a time of uncertainty, and there have been many changes that we have all had to grapple with. But Health District remains confident, and I remain confident that with the availability of a safe and effective vaccine for those who choose that to be protected, that we will continue to see our progress and our path forward out of this pandemic and out of these trying times. Thank you.